Okay, hello. Good afternoon.
Good afternoon.
My name is Ahmed. I'm an ST5. How can I help you?
I'm ST1 trainee, and I want to sign my OSAT.
Oh, I didn't get your name.
Nurhan.
Nurhan, hi Nurhan. How are you doing? You okay?
Yes.
So tell me that you need to sign the OSAT about what?
About Pessary insertion.
Good, Pessary insertion. How did you do in training? How's training so far?
I didn't train it very well, but I see it more than once in the clinic. Yes, and I wanted to know how to insert it and
Good,
how
perfect.
I search for it.
I'll show you. It's just easy, too easy, okay? And
Yes.
could you please tell me, what did you choose Pessary specifically?
For vagina prolapse and for supporting the vagina.
Okay,
and
perfect.
uterine prolapse.
Okay, so I'm here. Just first, I would like to, if you could demonstrate first. I just need to know.
Yes.
How would you do it by yourself? And I'm more than happy, to comment on your technique, on your maneuver. Okay.
Okay.
Will that be okay?
Yes.
Okay, then show me.
I think we start to put it like that.
Okay. Well, perfect, Nora. Almost right. But
Yes.
first, let me just remove it first, and I will tell you, a few points. Okay, you did perfectly well, but first of all, you need to ask the patient. Like, just imagine that you have a patient over there, right?
Okay.
And the patient, you need first to take consent from the patient. Now you choose the Pessary for the patient. This is perfectly good. Okay, and now you need to tell the patient, take consent from the patient that you're going to insert a Pessary and to do the patient education.
Yes.
That for the self-management.
How to clean it.
How to clean it and this, right?
it.
Then next. What's the next step, Nurhan? Do you know?
No, I don't.
Exclude the complications.
Oh.
Do you know what's exclude? Sorry, the contraindications.
Yes.
Do you know what kind of contraindication you need to exclude first before?
No,
You're
I
not
don't
sure.
think
Okay,
so.
don't worry. This is just fine. Okay, you need to exclude any undiagnosed vaginal bleeding, any erosions there, any infection, because you cannot insert the Pessary in such conditions.
Okay.
Having done with this, right, you're ready to select the type and the shape and the size of the Pessary.
And how I can do it?
Well, first it depends on this is a perfect question, Luhan. This is very good question. First, depending on the patient primary complaint, right?
Yes.
We have two types of Pessaries. We have the supporting Pessaries like this one. This is the ring Pessary, and we
Yes.
have the space occupying one, like the cube, like the gel horn one, right?
Yes.
The supporting type will allow for sexual intercourse, right? They're easy to be inserted, easy to be cared of, right? And they're mainly used for preventing or treating or management of the uterine prolapse itself. The other types, the cube and the space occupying, would interfere with sexual intercourse and also would use to treat the cystocele and rectocele. Do you know what I mean? Still with me?
Yes.
Okay, perfect. So now we suppose that the patient is sexually active and she doesn't want the other type, the space occupying one, and she's happy with the ring, because suppose that she has uterine prolapse,
Yes.
right? Then we have all this. Next, the fitting. Do you know how to do the fitting? Because we have different sizes of this.
Actually, no.
Okay, perfect. No problem. So you need to ask the patient to take permission first for a PV for a gynae exam. So ask the patient to uncover herself from down below, go to the toilet to empty her bladder, right? And ask the patient to lie down on the couch, expose herself from down below, as I have told you, and also don't forget the chaperone and the private room, right? Then suppose this is the vagina of the patient, so you need to do a PV examination of the patient. So insert your hands down there and all the way to the cervix, then to the posterior fornix of the vagina. Then, spread your fingers in between the posterior fornix and the pubic arch. This is measurement number 1.
Okay.
Measurement number 2, you
This is
rotate
the vertical.
This is the vertical one.
Yes.
Then the horizontal one, 90 degrees, right?
Yes.
To get the maximum width, right?
Okay.
Then slowly, withdraw your hands like this and use the distance between your two fingers in order to get an arbitrary measurement of the size of the Pessary, just like this. Do you know what I mean?
This may fit it.
This may fit in this,
Yes.
right? So this is now the fitting. we're done with the fitting. Do you know what I mean? Did you get me?
Oh, okay.
Now we're ready for the actual insertion itself. First of all, you need to, with the patient still in, on the table, on the couch, you need to wear your gloves. First, you need to sanitize your hands first.
Yeah.
Don't forget about sanitization. Right? Wear your gloves like this. And hold the pessary. Hold the pessary. Hold the pessary between your hands.
Yeah.
Right?
I fold it.
You fold it, yeah. And with some gel like this, with some gel like this. Sorry. All right. You do some gel on it. Okay. And fold it between your two fingers like this.
Yes.
Right? Fold it between two fingers like this. Then slowly, right, with your non-dominant hand, spread the vulva a bit like this.
Okay.
Right? Then slowly, posteriorly and downwards. Downwards and posterior backwards like this. All the way to the posterior fornix. Right?
And then release it.
Release it. And then the anterior part, right? Just with one finger, push it to the pubic arch. Just like this. We're done. Right?
Yes.
We still have the patient on table, so you need to do something like a test of fitting. So we'd ask the patient first to cough, to do the vulva, and just ask the patient if there's any pain at all, because sometimes it's a little bit painful, so you might need to remove it and pick another one, right?
Yes.
And diagnose if there's any de novo incontinence, any leakage. Then you're done. Ask the patient to get dressed and document your findings, document the size, document the type, document everything, fill in the audit form if you have it, and ask the patient to come for follow-up visit after first. Do you know when should she come back?
I don't know.
It's 4 to 6 weeks. This is the first visit. This is the first follow-up visit.
Yes.
4 to 6 weeks.
Yes.
Right? When she comes back to your clinic, you need to check. First, you need to remove the pessary. Okay,
Yes.
if it's remove the one with the anterior first, then the posterior should come back as less. Right?
Okay.
See if there is any erosions, any discharge, any pain. Ask the patient about the symptoms and all this stuff, right?
Okay.
Then you might use it again, the same one, rinse it and use it the same one again, or you might consider using another one, right?
Yes.
Ask the patient if she's happy with it or not happy with it.
So she has to remove it at home or just...
No. For the ring pessary, it has to be removed.
In the clinic.
It doesn't have to be removed at the clinic. It doesn't matter. So she can remove it by herself. But it has to be removed after 4 to 6 weeks first. This is the first follow-up visit.
Okay.
Then you insert a new one or use the same one. Then after 3 to 6 months, she has to come back again.
Okay.
All right. When she comes back again after 3 to 6 months, you remove it and check again. Do the same thing. Check for any complications. So do you know about the complications of pessary, Norhan?
No, I don't think so. I thought it is a safe maneuver that...
Yeah, it's perfectly safe, but we have pain, as I've told you, erosion. This is the most important thing about the patient, erosions, right? And it's treated by estrogen cream. And pain and infection, and this is the most common complications.
So it is just for relieving symptoms, but it is not a medication or...
No, it's not a medication. No, it's not.
Treatment for
it's
the
not.
case.
Not at all. Right. So do you have any questions so far, Norhan?
I want to know if you will sign my...
Well, I am happy to write down the feedback, write down what went well and what could be improved later on, okay? I just have a recommendation for you, if you have time,
yes,
to attend the clinic, the urogynec clinic. As for myself, if I see a patient who needs a pessary, I will drop you a line or contact you or call you. Would that be okay? And also there's a couple of resources on the website, right, on the RCOG website, all right? E-learning, I think, every trainee now has an access to the e-learning website on the RCOG,
yes,
right? So you can go there, check for a couple of videos, couple of resources, and also I might send you the guideline for Pessary insertion, right?
Yes.
How about that?
Yes, that's very good.
Okay, so I'll write down now the feedback. And do you have any questions for me so far?
No, thank
Okay,
you.
I'm so happy.
Thank you for
I'm so
your
glad
time.
for meeting you today, and good luck with your career. Thank you.
Thank you.